Namaskar, hello and welcome to the Healing Hour. Today we are commemorating the World Occupational Therapy Day. We all have heard more about the physical therapists, the physiotherapists in particular, who come to our households, and perhaps we go to them. They give us some kind of ultrasonic wave treatments and the TENS therapies and different kind of physical exercises to help us recover. But then occupational therapy is again a very elaborate branch of therapy, which, as you can see on the back of our screen, which helps multiple conditions, and it focuses more on fine motor skills. We have been joined in by Dr. Surbhi Vashmittal, the president of Arogyam Institute of Integrated Medical Sciences. And डॉक्टर साहब आज का विषय लेने से पहले we would like to understand what is the difference between a therapy and a treatment. We keep on in our last episode when we were talking about the stuttering, there was a mention of the speech therapist for that matter. So what is therapy and what is so that will really help our viewers more into the nuance of medical terminology.
So, namaskar and very many, good wishes and lot of power on the World Occupational Therapy Day, 27th of October today. So, when we talk of treatment and therapy, any disorder, any disease has a treatment outlined by a doctor. When we talk of the treatment, we say there is an, component of medication to it. There is a component of ahar, vihar, and vichar, which we say at of course, at the Arogyam treatment lines. So treatment essentially comprises of a standard protocol, and a few drugs or treatment strategies wherein we evaluate the prognosis once we have the diagnosis and we work on that plan of treatment. Now, therapy, the word therapy, is the actual attributed meaning to it is more holistic, where we talk of it takes into account a lot of psychosomatic, emotional, environmental, social, psychological factors into it, because any human being who is being treated, any person who is being treated is not just a single unit in isolation. So therapy is much more holistic, I would say.
Okay, we'll come back to this topic of therapy, like we go into the history. So the earliest evidences of using occupations as a form of therapy, the dates back to around 100 BC, and Greek physician Asclepiades used therapeutic baths, massage, exercise, and music to treat patients with mental illness. And the first occupational therapy department in India, it was established at the King Edward Memorial Hospital in Mumbai by Mrs. Kamla V. Nimbakar. So, Doctor, is this a pure medicinal field, or it's a support or an allied field of medicine for that matter?
So I would say it is a combination of medical and allied specialties, in which we have, occupational therapy in itself is a therapy, a branch of, you can say medicine, of course, wherein we have, a treatment of, in the form of physical, social, or emotional disabilities or disorders which we are treating, So therapists may be in the form of physical therapists, they may be in the form of speech therapists, they may be in the form of psychological therapists. All this
Okay.
comes under occupational therapy. And occupational therapy, since the definition lies in the word itself, that we are trying to empower and enable the people, the patients to come up to their activities of daily living or their occupation or their functions, which they're somehow not able to complete or do. So in a sense, this is somewhere, trying to step up or bolster their quality of life, daily life, in terms of plugging in those lacunae or those gaps where they're facing problems. Say, for
So
example,
is it
even
is it some kind of a support? For example, we undergo some injury or something like that. We come to each of the use cases shortly. So the family support, the family care, what has we largely witnessed in India, especially because in literature they say that therapy per se is gaining a lot of market share because of changes in the society. So how would you like to push, like visiting a doctor, an empowered one is something which you cannot do away with. In fact, in our houses, a basic level of nursing or mothering, as we say, is usually done out there. But then the families are getting nuclear, the older citizens are staying without their next to the kith and kin for various reasons. So the older people, it's good that they are staying even in their homes. They need some external support for that matter. So kindly throw some light in this perspective.
So, the care protocol, when we talk of any disorder, disease which we are treating, we talk of the care protocol. Care, the word care itself is such a deep word, So any disease, any disorder doesn't get treated just by the treatment alone. It needs
Okay.
a lot of care compliance. And that is where the role of the family, the institution of the family, the caregivers, the support givers, the emotional caregivers, everything comes into account. So definitely, if you see the modern fast-paced life where, even geriatric population, the elderly people, the parents, the population is largely, there are gaps in this, wherein we don't find the joint families or the warm, atmosphere where three generations are under one roof. That is something which is missing, of course. And in India, still we still have that tradition to an extent. But this is the essence, when we say a lot of geriatric patients, when they come to my OPD, I tell the family, I tell the persons, that when you bring your mom-in-law or your mom, please, bring at least the bahu and the son, and or who is the caregiver, come with, along with your parent, because it's important for the caregiver to also understand the treatment paradigm, the treatment protocol, so that it can be administered in letter and spirit. Not just in letter, but in spirit as well. So the emotional aspects, the psychological aspects, the environmental aspects, all this needs to be attended to. And when we talk of occupational therapy, a lot of these therapies are coming into practice. Of course, this is a field of physical therapy, and rehabilitation is a part of occupational therapy also, you can say. There are several use cases where medical intervention is sought for, but then the need for this intervention is exacerbated or increased or accentuated by the collapsing family structures, wherein
Mhm.
the parents, the elderly population, even for that matter, occupational therapy is even given to children, sometimes with some disabilities, some developmental milestones, which are not coming in, or some
So
kind of.
do the patients have to visit some center or some clinic for taking these therapies, or it can be availed right in the comforts of your homes?
So today, home care has really advanced. If you talk of the corporate hospitals in Delhi and the major metropolitan cities, they all have home care departments, and so this is something where the therapists come to your home and they can visit. But then few visits to the centers, maybe if you are visiting, there is some like pincer
Advanced
grabs not
machinery.
there. Yeah, so
Mhm.
equipment, machinery would be there at the hospital or the centers where you आपको visit करना पड़ता है. You have to visit those centers to get oriented initially. But then
Mhm.
once you get primed, then those follow-up sessions can happen at at the home care
Mhm.
setting as well.
Dr. Saab, let's come to each of the clusters of where occupational therapy comes to rescue. It all started in the era of World War One, where the patients it was used more as a mental disorder ailment. Like if a person is occupied, that was the whole philosophy behind. If he or she is occupied in some productive work, the fine motor skills, perhaps the mental trauma of getting disabled is perhaps was taken away, and now this therapy has taken up in a phenomenal fashion. So physical conditions, like we understand that broken bones, burns, carpal tunnel syndrome, strokes, amputations, spinal cord injuries. So how occupational therapy is conducted in these physical conditions?
So, for example, burns, burns is something which is their first degree burns, their second degree burns, their third degree burns. So a lot of rehabilitation is there as a part of the treatment post the, incidents. So this would mean, essentially a lot of confidence building, a lot of,
Okay.
physical therapies in the form of helping the patient walk. Sometimes there are certain, functions which might be impaired, due to the effect of
So there
the.
is an inherent psychotherapy involved as well as a
Oh
part of
yes, oh
occupation.
yes, it's a very very important aspect. Say for example, there is a fall, there is an injury, broken bones, and then especially in the geriatric population where they need to be so careful
कि
about.
मैं तो अभी उठ ही नहीं पाऊंगा, मैं तो
Yes,
गिर
yes.
गया तो अब मैं कैसे चल पाऊंगा?
So that
ओके.
phobia which comes, ki, will I ever be able to walk again? That kind of a syndrome which happens. So we need a lot of confidence building measures and a lot of psychological and emotional uplifting. And that's where, as you said very rightly, that caregivers, close family, and all this has a lot of role to play. In fact, we say the PIN or the psychoimmunoneurology, the PIN factor, which plays a role in all the disorders and diseases. A lot of research is going on in the modern times, but then this is something which is the intangible factors, a lot needs to be understood.
So how come the occupational therapy helps the mental health conditions like the depression, anxiety disorders, and schizophrenia? So
So,
yes,
mental
yeah.
health conditions, depression, if we say the classical triad of helplessness, hopelessness, and worthlessness, all these mental health conditions are normally in clinical practice, clinical parlance treated through drugs and medications, through psychiatry.
Mm-hmm.
But then, there's a lot of role of cognitive therapy, a lot of psychological counseling, a lot of, emotional support again, and then, behavioral therapy, all this. So, occupational therapy in mental health conditions is very, very vital,
Mm-hmm.
Because what we say, medicines play only, say, about 20% of their role, that
Mm-hmm.
too in advanced cases. And even modern day psychiatrists say that जिस घर में बड़े बाप दादा हैं तो वहां पर तो ये प्रॉब्लम्स इमर्ज ही नहीं होती हैं। जो बच्चे हैं वो बड़ों से इंटरेक्ट करके उनका आदान प्रदान होकर उनका जो मनोबल है वो इतना बढ़ जाता है और जो युवा पीढ़ी है वो तो दोनों से ही इंटरेक्ट करती है। So this is something which is a mutual give and take, and this is how that a strong family tradition, helps in overcoming this. But then occupational therapy plays an important role, yes, in terms of pulling up the morale and the overall improvement, overall response of the treatment. 20% is medicine, if at all it is, and 80% is lifestyle, is counseling, is belief, is attitude, is confidence, is the motivation, this is how it can be tackled. Anxiety disorders again. What is anxiety? Anxiety is a super normal state, wherein slightly more concerned the person becomes, so a
Okay.
state of neurotic condition. Anxiety comes under the neurotic conditions. So why anxiety? Because either the person has been made, gone into that state of constant worrying, thinking, overthinking, anxiety. So a lot of things can be, why to give tranquilizers all the time? You can really tackle by meditation, talking to yourself, talking to the patient, and being friendly, not taking this as a stigma. It can happen to anyone. Let's not
So
let's not
what's a particular time frame of a kind of a therapy session? It seems like doctors are really busy people creating accurate diagnosis and prescribing a lot of treatment plans, medications, and doing
true.
surgeries and so forth. So therapy is a typical session. What is the time span which a
So,
therapist
so,
dedicate?
so usually, at least 30 to 45 minutes is something which a therapy
Okay.
session would take. And so that's why we have a specialized branch, wherein we have therapists, even a psychiatrist has a battery of, clinical psychologists, counselors, and, a lot
So
of
there are support people who go
what?
out
Yes,
and
right
help the
stuff.
larger medical space.
Definitely,
Mhm.
definitely. And because, you would also like to understand that counseling is an art, you know,
Mhm.
counseling is an art. And a lot of spiritual component also goes, the quotient of spiritual quotient goes into a lot of counseling. The counselor himself or herself has to be very, very empowered, empathetic, and kind of trained, of course, but then empowered and empathetic is the core. And how does empowerment come? When one, you have knowledge of all the various kinds of problems and thought patterns people have, across strata, across societies, across races, I mean, across populations. But then also that you have empathy. You're not able to, if you're not able to relate to the patient's life positioning vis-a-vis the emotional, environmental, social factors. I mean, the great job is done when you are empathetic and empowered both.
So
But
do the therapists they report back to the treating doctor or they have
yes,
their own independent
so usually they work,
sway?
yes. So usually they work as a team. They work as a team, and it's all in sync. But sometimes, the clinical psychologists, like, they may even exist independently. So they may be recommended by the psychiatrist, and they may
So
visit.
basically it's imperative on the patient or the caregivers largely to synchronize the contours
Yes,
of treatment which are being made.
yes, the
Because the
compliance is.
treating doctor might have envisaged a particular way going on, and the therapist might be overstepping or understepping the
So this
areas.
this is definitely a subjective issue, and this
Uh,
is something which is, and an outer regime has to be, you know, yeah. I mean, this is, of course, there is this, there can be this
mhm.
this issue.
Okay, okay. So somewhere or the other, is therapy also close to nursing? Because in India, we understand nursing as a civilizational space. Nursing we understand, but therapy is close to nursing, or is it what? Uh,
Therapists, therapy comes from the word therapeutic.
mhm.
Therapeutic means treating. Nursing is a very, very, I should say, a very noble form of healing, in which actually, when we say Florence Nightingale, nursing is something which where you are tending to the patient from the micro level to the, the smallest needs are being met out. When a patient is admitted in the hospital, even your sugar levels are monitored by the nurse. Your
So it's
bandaging,
much more
dressing,
intense. You wish to
very, very
say
intense, very intense. It's
nursing is very intense.
very
Okay,
intense, very intense. And therapy is something, it's close to the physician, close to the doctor, close to the treater. You're treating, like we say, therapist. So therapist is we can say like a health professional, somewhere between the doctor and the nurse.
okay.
So a therapist would guide you, help you to, uplift your activities, daily living, your functions, vital functions. Say, for example, multiple sclerosis, like we have when you talk of the chronic illnesses, there are some
Mhm.
problems, in the bowel functions or the urinary functions. So this is, of course, where the physical therapist will come. They'll tell you some exercises, how to, and then, of course, then how to deal with, such problems, when even though you are trying your best to cope up with them, so there may be muscle spasms, there may be contractures, there
So
may
is
be
it imperative
stiffness.
upon the occupational therapist to if there is a problem which they see that it is not being solved, so a medical intervention is required. So are they bound by the ethical or the professional guidelines
Oh,
to
yes.
report on their own, or they keep on continuing? Because somewhere or the other, what happens is we all have incentivizations in a professional field of work. So the patient trusts, patient is in agony. So what is the kind of ethical code
So,
on part of the therapist?
So we do have a field of physical therapy and rehabilitation as a post-graduation field in the medical sciences. There's an MD of physical therapy and rehabilitation. But this is, occupational therapists would be definitely they would be trained and they would be qualified enough then when they are going out and giving their therapies. But it's important for a doctor, a specialist of some, say for example, if it's an orthopedician or if it is a skin dermatologist or a psychiatrist, to be in charge of the entire treatment. And the occupational
Mhm.
therapist, the therapies and all these should be in his knowledge, his or her knowledge. And then, that is this
So
the
it's
very
not kind
important
of going to a spa or a massage. It's a medical, it's a profound medical space. Because
profound medical
generally the
skill. Yes,
common parlance people have different kind of thought process कि भाई मेरे तूने घटुआन घटुनान में तेल लगाए दे गरम करके कड़वा सो. So in a cultural, in a civilizational society like ours, we really need to train or alert our especially the geriatric population for that matter, that is
yes,
the therapy being given in the right space,
yes, yes,
under the right protocol. That
yes.
is all. How does occupational therapy helps in the learning disabilities space? Like dyspraxia, the developmental coordination disorder. So how does it actually help?
So again, as I said, that children sometimes or the younger population, they have certain kind of disabilities and disorders in which, this occupational therapy plays an important role. For example, there may be some motor and sensory coordination, the certain, some birth injuries or some kind of trauma or emotional even, or, genetic defects, So that's where occupational therapy plays a role. Basically, this is trying to help the child or help the patient acclimatize and cope with the problem. So dyspraxia is as in developmental coordination, like pincer grasp. There are certain machines and equipment which help the child to grasp and increase the power and tone of the musculature, the hands, the fingers, the brain and the mind control, the hand control, motor sensory. So this is all a lot of equipment has come in. There are the thyra bands, there are those balls, the gel balls, and there's a lot of equipment. I mean, there is a lot which is there available in the medical sciences for the for the upliftment of the quality of life through these occupational therapies.
Mhm. Lovely, 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 lovely. Doctor, Saab, you touched upon the chronic illness area. You touched upon the geriatric population in particular. So how does occupational therapists they come and help the chronic illness regime?
So chronic illnesses, yes, of course, that like we have talked about multiple sclerosis here. It's an autoimmune central nervous system condition in which the body starts attacking its own, the system's body's myelin sheath. There are a lot of musculoskeletal, visual blurring of vision, and bowel and urinary symptoms, and all these problems can be, see, there are certain chronic illnesses where the cure is not definitive. I mean, it is not there that it can be cured completely. So sometimes there is a longer duration of the treatment, prolonged suffering is there. So that's where the attitudinal, the motivational, the behavioral, the coping, and the exercises part of the treatment, all this plays a very vital role. Similarly, for example, if we see, chronic illnesses wherein even the cancers, when we talk about, that when the adjunct therapies are going on, chemotherapy, radiation therapy, and, post surgeries, brain surgeries, a lot of, psychological symptoms. physical symptoms, even neurosurgeries have sometimes defects, post surgery, sometimes vision is not there completely, some nerve has been, touch or hearing also. So these auditory, visual exercises, all this would be, needing a kind of holistic approach in which we are trying to bring back the activities, the functions, the vital support, the confidence building measures. All this is important, and that's why medical guidance and medical awareness, is important. So that's there.
Okay, lovely. So I think we have covered a lot of grounds from physical conditions to the mental health conditions to chronic illnesses and then developmental disorders and learning disabilities. Occupational therapist is a boon, perhaps, to a ailing society where perhaps even the caregivers, with the best of their intentions, don't have the professional skill sets to handle, for example, the stuttering space, we said that the speech therapist. So, professional care is somewhat people look at, and the family can surely learn from those sessions and
Yes.
expand that space of care. They can give empowered care further and forward. So, as our society is getting complex and complex disorders, diseases are coming into the fray. Healthcare professionals across the spectrum are coming to our rescue. And Dr. Saab said a very important thing, that care convergence has to be the vital factor today, because multiple schools of thoughts do remain. But do be in the care of your family physician, taking counsel on the regular updates, because doctors are busy people, so updating them, following up with them is something which keeps you in the loop. And ati sarvatra varjayet, because any session which has to be taken, the response time frame, and if the situation is not improving, so there are other interventions perhaps. So following the care protocol, whatever has been prescribed, is something so very important.
Yes, and
uh,
this is where the role of the family physician comes into play. Very, very important, because there may be two, three specialists, there may be multiple therapists, and who's coordinating the central node, the doctor on record. That's where, this is very, very crucial role of the family.
Yeah. So I think that very institution of a family physician who used to visit your homes, or your dadaji, or your entire family, would have been family after family would have been consulting, because they have a vital understanding at times. But today's when we are all armed up with a lot of, I would say, money in various forms, either corporate insurance or the governmental policies and things like that, there is a risk of over medication, over therapy as well, because everything has got linked to the economic side of it, and somewhere or the other, the relevance or need of a particular care protocol, it has to be audited in the first place. सो हमारे भारतवर्ष में जो एक परंपरा रही है कि गुरु, शास्त्र और साधु, इसकी त्रयी का जो ट्रायंगुलेशन है, it should be done. Everyone is respected, everyone has a space over there, but one cardinal principle what we would like to relay from this platform of the healing hour is, there is no harm in triangulating the opinions and trusting your general physician, your family physician, whosoever he or she might be, is something which can be relied upon. And many of the countries, many of the advanced countries, you just cannot go to a specialist or a super specialist without the consent of your GP, because he or she is the person where all the care convergence happens, and
Can I
he's a
tell
kind
you?
of your, yeah.
I tell you that I receive a lot of queries from patients and patients' family. They ask that, can we apply this oil and do massage, on our own?
Mm-hmm.
Daughter-in-law asking, and so on and so forth for my mother-in-law, or a son saying that, "Ma'am, can I do this? This kind of a home treatment, or in the form of, maybe cold, hot and cold fermentation or something like that." So these are the home care remedies. And I tell you, the human touch is miraculous. When a family member having a massage therapist is one thing, but then when a family member does that kind of service, is what we say seva, for the family elderly person, or it has a lot of emotional aspect and a lot of healing
Mm-hmm.
aspect. So I
Lovely,
would
lovely,
I would
lovely.
I would appeal to the doctors and physicians, the family physicians, that guide them as per, the massage should be like this, and you can do it in this part and with this pressure. And
Perhaps
it's
there is no
unless
harm in that. The traditional remedies, whatever we have in
absolutely
parampara, until or unless it is invasive, it is non-invasive.
true, true,
I think there is no harm. The great, I would say, the traditions, whatever evolved over a period of time, and today is a time like all the technology is converging. Maybe we will be having a healing hour on that very specific topic.
Mhm.
There's a talk of the fourth industrial revolution where all the technological platforms are converging into one, coalescing into one. So perhaps the various medicinal disciplines are also finding resonance with each other, and they are finding complementary to each other.
True,
Perhaps the siloed approach, oh, this is the only discipline, and we will not even look at you, kind of enmity between a North Korea or a South Korea, that kind of phenomena. So perhaps I think that is also one of the subject matters of the healing hour under the integrationist medical protocol. Because at the end of the day, whatever discipline of medicine, because therapy again, it has been evolved from a different requirement. And if we see, we usually used to have therapies, long counseling sessions with our parents, not teaching any subject in particular, but asking how did your school go, or even India, though even the younger lots or the elder ones keep father in his 70s ask a 40 or 40 something son, बेटा तुम्हारा ऑफिस कैसा रहा, बॉस तो ठीक है, सब ठीक तो चल रहा है. So I think that is also part of family therapy, we can perhaps say,
true,
that
true.
dining on the table, sitting together, sharing, exchanging the emotions, the challenges, केवल एक बड़े का एक हाथ, it will all pass through, don't worry. This is a grinding, this is a drill through which you will all pass through. So from occupations to even the schooling, I think we have to also bring in our these traditions back in some way or the other, rather than inviting a professional therapist. That's fine, because at the end of the day, if you see their basket of psychological interventions, if the problem is not so very acute or chronic, I think on the periphery, a lot of it can be addressed. As Dr. Surbi said, that a daughter-in-law massaging the head of her mother-in-law. I think that is the best beauty of the Indian tradition. I think with this we'll close, and we are on the uh, so we'll bring more nuggets of healing, the integrated healthcare, the intertwined insights into integral healthcare. We will be continuing this series with you. If you have any specific questions or queries, you can pose them in the response window in the comment section of the YouTube. And if you really wish to contact Dr. Surbi for any consult, you can WhatsApp her on 8700603112, and she will be truly coming to your help and rescue. So we close this healing hour with a lot of wishes of the coming festival of Diwali. It starts with Dhanvantari Jayanti. Lord Dhanvantari, who is the custodian of Arogyata. So thank you.